see people. Hello, welcome. You see people trying to still log on, but thank you for being here. Feel free to put your name and pronouns and what you do in the chat. That would be great. We're excited that you're all here today. Awesome. Well, we'll let individuals kind of trickle in, but we're going to get started because we have an amazing um, packed session for you today. So, thank you for putting your information and if you feel comfortable using your pronouns, that would be great as well. Thank you. I love it. I love it. Oh, and where you are located too. That would be great. So. All right, well, let's get started. My name is Evelyn Clark. I go by she, hers. I currently reside in Olympia, Washington, on the land of the Squaxin and Coast Salish peoples. And I am a member of the NTTAC Center as well as Change Matrix, and I lead the Peers and Clinicians Together sessions. So thank you again for coming. I just want to do a couple little housekeeping. I want you all to know that today's views do not reflect our federal funders. In case there is a security issue, we will stop this Zoom line and we will send you a new one. And I wanted to get started with a Pride acknowledgement. We are celebrating Pride Month this month, and this is what our topic is going to be on today. And I just wanted to share, and I could put these in the chat as well. I wanted to share ways that organizations can acknowledge Pride Month and LGBTQIA+ experiences. So first, we would want to recognize issues. So what that means is acknowledging issues that directly affect the LGBTQIA+ community, both locally and at large. We want to provide space for reflection, so allow employees time to reflect and discuss their experiences. And we want to listen to the stories and experiences shared by LGBTQ plus employees and communities. And of course, advocate for LGBTQIA+ employees and community members. We want to respect identities. So respect and acknowledge preferred pronouns, names, and identities. Consider impact and how the organization's decisions may impact employees in the community. And last but not least, we want to ask questions, asking hard questions of the organizations and its employees. So I will go ahead and share that in the chat with you. All right. Well, again, thank you so much for coming. Those who have came in, just share who you are, your pronouns, where you're calling in from or zooming in from. And we're just so thankful you are here today. So we're going to get started. I'm really excited to introduce our two subject matter experts today. We have Alex Filippelli, and we have Nicole Gertie here today. So what I'm going to do is I'm going to pass the mic over to Alex. If you could introduce yourself, who you are, the amazing work you do, and we're going to have a discussion right after this. So if our participants want to put some questions in the chat or just discussion points, we will get to those after our SMEs talk about their work and who they are. So Alex, if you could please kick us off, that would be lovely.
Yeah, no problem. Thank you. So my name is Alex Filippelli. I use he and they pronouns. And I locate myself as a white settler and as a queer and trans person. I'm an immigrant to the United States. I've lived here about 10 years. And I currently reside on Ohlone in Owaswas, or Ohlone, sorry, in Owaswas territory, which is in Santa Cruz County in Central California. And my background is in social work. I have a BSW and an MSW from the University of Victoria in Victoria, British Columbia, Canada. And I got into this work initially I worked in gender-based violence prevention in like sexual assault centers, doing like trans inclusion, LGBTQ inclusion work. And what I was finding in the sexual assault centers that I was working in is they were really like second kind of wave feminist like organizations, as many sexual assault centers were. They were established in like the 70s or 80s. And they were really struggling to, some of them were struggling to like move their framework to understand gender is more than a binary. And that made it challenging for the young people that we were serving in our anti-violence program. And then also for me as an employee who was certainly like socially transitioning and then wanting to embark on my medical transition. I was also, so I was just like, as a personal note, I didn't really come here to talk about my like personal experience, but I was a queer youth in the 90s before there was the internet. So it was a very different time, but I didn't understand myself as transgender until I was an adult. And I was also experiencing like barriers to accessing gender affirming care in Canada. And I heard about this organization called the Gender Health Center in Sacramento that was in Sacramento, California. It was a transgender-led, transgender-serving nonprofit that provides stopgap care for people, for trans people trying to access gender-affirming care. And so I was able to come here and to California and volunteer at this organization. And then ultimately they like hired me and offered me a work visa. And then I worked at that organization for 7 years. And the work that so that was a really like unique opportunity for me to go from being a trans person trying to work in women's organizations and not really having a location, like being able to like locate or have a place in that work as someone who was transitioning to male, and then to go and to get to work in a organization where like almost every single person that worked there was trans and almost every single person we served was trans. It was like a real privilege. And while I was there, I worked as initially as like a case manager, like advocating, helping people navigate the healthcare system, helping get them into care, helping them stay in care. And then eventually I also trained as a clinician and provide mental health services. And then Gender Health Center's model, they actually use an intern training model to provide their healthcare services and their mental health services. And so each year, there would be like a new cohort of student interns that would come through learning how to prescribe hormones, learning how to provide gender affirming mental health services. And so then I was directing those programs, providing training to those cohorts of medical and mental health providers. Um, yeah, just like helping evaluate the workforce development training. And that actually led me to kind of more where I'm in my career now. I do a lot of like, our currently I work at the Center for Applied Research Solutions. When they brought me on as a subject matter expert, I was doing a lot of like working with systems to train behavioral health workforces, conducting capacity assessments, needs assessments with clinics, county behavioral health, universities, schools, school districts, kind of like looking at the experience of trans people or like LGBTQ people also more broadly, but my expertise is really with the T. To be like, how can we create affirming policies? What are our practices? What is our organizational or clinical culture like? What are our documentation practices? What are the built environment? And then how can we create plans to take steps to make more affirming environments. At Gender Health Center, the young people that I was working with, they were sometimes involved in other systems of care, but they were coming to our agency because they couldn't get access to care in the systems. And so they were coming to this like free stopgap service clinic. And so our work was always like, how do we work with these systems to like change them so that they're more accessible for everyone that we serve, but certainly for young people. And so that's kind of the experience that I bring is I actually don't have like extensive experience working inside of a system and like providing care, but actually more being as like an external consultant and subject matter expert to work with your workforce, work with your administration to create more access to care. So kind of more on like a meso level. Yeah, that's my background. Thank you, Nicole.
Let's unmute me. Hi. Well, that is an amazing bio, so I don't know if I'm going to compare, but I will try. My name is Nicole Gertie, and I initially started my career as a nurse, and I spent a good 20 some years as a nurse and decided that I did not like how people were treated when in care. And I ended up social working people before I became a social worker because I was very, very unhappy with the way that people were treated in the medical care system that I was involved in. I am from the lovely Marysville, Ohio, which is very, very rural. We call it the Union County traffic jam when we get stuck behind a tractor, and it is a very, very small community. So I am 6 years ago, I became a licensed social worker. I am working on my master's in clinical therapy right now. And I am also a mom to six. We have four that we have brought into the world ourselves and two that we have adopted and have been amazing. And I would take 10 more if my husband would let me, but he says no. So what really brought me to start to work with this community was not only my job, but also I have a child that identifies as a member of the LGBTQIA plus community. And I will be talking about that child today and her lived experience, but to backtrack a little bit, in my job, I am a wraparound facilitator and a parent peer support and a peer support. So when I came to this position, I was very disturbed by how there were not many resources for our LGBTQIA plus community in our very, very rural town that is not very accepting of anything of that sort. So I got together with Ren Hawkins, who I work with, who is our lead family coordinator. And we started a program where the kids would meet once a week here with some other members of the community so they could kind of build a partnership, build a community within their community where they were safe. And while the kids were getting to know one another and finding that safe place, the parents would meet across the street at the coffee place. So they were getting support too, to kind of navigate this new culture that we were trying to cultivate in our county, which we are still working very hard to cultivate in our county. So that went on for a while, and that kind of served its purpose. And then we moved to an art group once a week, which has really skyrocketed. And it's a reason for the kids to get together. We use art as the excuse, but it's grown substantially and it's been wonderful. So now we're working on integrating our programs into the schools, which has met a lot of resistance at this time. So we are working hard to make partners and allies within the schools, safe places, teachers that kiddos can go to when they need help, meeting with the guidance counselors so they can give the correct counsel to these kids who are struggling with their identities and to use the correct pronouns, to use the correct terminology. Where we set up trainings, we go in and I meet with people all the time. I have a couple of kiddos on my wraparound caseload that I meet with in like their settings, and I advocate for them. So my main role is to advocate for those kiddos. I call everyone kiddos. They could be 25. I call them a kiddo because I'm old. So I advocate, and then I have started this own journey with my own child who just announced quite recently that they are non-binary. And I am still trying to get everything right when I talk about my child. They were initially female and now they are identifying as non-binary, which is great. Hallelujah. Celebrate my kid. She's they are highly supported, but I am still learning. It's hard when you have had a child for 20 years to change your vocabulary, but we are learning together as a family, the whole family, we're all learning and being respectful and being affirming to, I'm still allowed to call her my daughter, I asked. So I am still allowed to call her my daughter. We are being affirming to their choice of how they would be called and referred to, and whatever that journey brings. We had a very challenging time in high school. It was quite brutal. And now they are in a college where they are fully accepted and can fully be themselves and are really discovering who they are and where they fit. And it has just been such a rewarding experience to see them get out of this tiny town and just kind of spread their wings and become who they want to be. And I am a huge advocate within my agency to do that for the families that I work with and to give those kiddos the support and to support the parents in this journey. I am also a parent-peer support provider. So I support a lot of parents whose kids are in this journey because they want a parent with lived experience. Like, tell me what to do so I don't mess my kiddo up. So I love that the parents are open to learning and open to what is available out there. So that's kind of a snippet of what I do. So I'm kind of here for the lived experience part, but I do have my feet in the clinical, well, not the clinical, the mental health world. Someday I will be clinical in about 9.5 months, but we'll see. So that's my little spiel. That's my little bio.
So awesome. Thank you so much. So much wealth and knowledge and experiences from both of you. So thank you again for being here. I'll just ask a quick question, and I see we have one in the chat, and I'm excited to open it up to participants. But I know we both talked about your work, and I so appreciate that. Um, just to kind of dig a little deeper, can you share how we can um, better support access to services for our young people who identify as LGBTQ plus IA? Is there something that organizations or the workforce can do to better serve our young people? And this is for both of you, so either one can jump in.
Go ahead, Nicole.
Oh, goody me. I was gonna say Alex, because Alex does everything. My big thing that we do in our county, and and like I said, we're starting small here because we're really just getting this moving in this county, but we have worked hard to educate on gender identity, sexual orientation, romantic orientation, gender expression, use people's pronouns. We use our pronouns within all the work that we do. So therefore we create this atmosphere that when we go out, that pronouns are being respected. If a kiddo is in the school system and they want their name changed, we go in, we help advocate for that, advocate within the school, advocate with the family. We even just changed our paperwork recently so we can, you know, in this town, that's a huge deal. So you can actually identify who the child is on paper, and it's not just like male or female, because that's not right. So we work hard to try to be inclusive, and it's met with a lot of resistance here, but we're very lucky that we are attached to our mental health and recovery board that kind of runs the town. So it's a really great thing, and we're able to have those things in place. There's so many more things. Like, Alex, when you tell me about all the amazing things you guys are doing, I'm like, oh, how great to do all those great things, like, and have all those opportunities. So we're really working, we're trying to work with bigger agencies so we can learn to do better and be more open and be more responsive to the care our kiddos need. We work hard. I visit tons of meetings, parent meetings, organizational meetings, parent groups, just to educate and try to get parents to see how important it is to truly honor who these kids identify as, instead of who we want to push them in their little box, like you're gay or you're not gay. And there's so much more to the spectrum than those things. So that's what we're working hard to do. And I try to advocate everywhere I go. I sometimes get a little obnoxious, but that's okay, because sometimes for our kids to get heard, we got to be a little obnoxious. So that's how. Now, Alex will probably have a lot more cool stuff to say.
No, I mean, Nicole, thank you for your service. I like second everything that you said. I think my short answer is the things that you've already said, that it's just, and I want to just reiterate how important it is, especially when you're working with youth, to work with their families, their caregivers, and youth don't have legal rights or the ability to oftentimes like consent to their own care and or seek care voluntarily, and sometimes in California they do, but I know this is a national audience, and I'm by no means like a policy expert on what access to care looks like in every state in this country, and it's like changing rapidly also. So yeah, like really like working with families and caregivers is so important. Or in lieu of families and caregivers, having like really building relationships with other folks that that are within the systems of care, that are within the young person's ecosystem, like the school, for instance, and having a really strong relationship with an administrator or with a few teachers, or if there are like after school or like outside of school programs or community programs that you can build relationships with, so that young people do have just some spaces where they can experience affirmation and be themselves. Those are really, really important protective factors. Um, and then, with trans, and oh, one other thing that Nicole said that I kind of want to build on a little bit, but she mentioned the importance of, being able to updating your documents so that young people are like documented correctly. It's really, really important to collect data on who you're serving. One of the great challenges of getting access to care for the LGBTQ community is there isn't a lot of data collection, and in particular for trans people, gender is asked as a binary, like single option question that conflates the gender that someone lives as or truly experiences as themselves with the sex that they were assigned at birth on their original birth certificate. And so that conflation erases trans people, and it also erases or masks the scope of care that people might need, or also like the ways that we experience joy and don't need access to care. And so, data collection is really important to understand, like there isn't going to be funding for an issue if there isn't data to support that an issue needs to be addressed and that it exists. So that's really important. Additionally, for trans folks, I think for anyone, knowing how to navigate the system locally, but trans people do have additional barriers to care that are legal or like medical. And so understanding how to navigate those. Something that we did at Gender Health Center was a lot of healthcare enrollment and then healthcare navigation. So, and when the Affordable Care Act rolled out, California chose to expand their Medi-Cal system to cover many more people. I know that not every state did that. And what that meant, trans people had historically been excluded from care because of the pre-existing conditions clause, right? Which is really messed up when you think about it, because it's all like gender identity disorder. Gender identity was classified as a mental health diagnosis, and it also meant that you couldn't access care. And also the appropriate treatment for that care, like the only like evidence-based treatment is like access to medical affirmation. So, it's like really like, it's just a very problematic historical legacy of transphobia that exists in our health systems. And so we were just signing like hundreds and hundreds of trans people up and other folks for health insurance, and then helping them figure out how to get assigned to a doctor, and maybe like learning how to ask for what they need from a doctor for the first time in their lives. And so providing that kind of like support, getting people access into care, that was a real big focus of our work. And then working with the providers, right? So that to kind of like bring folks together in those relationships.
Wow, thank you both so much for everything that you do and have done. So it looks like we have some questions from our audience today. And I'm going to ask Desiree if you want to come off mute and ask, you certainly can, or I can ask the question as well. All right. Well, feel free to come off mute, but I'll start the question off. So how can we support the online community? She said there's so much kids online that need support.
Well, I can say in our in my experience with my own child and in our community, we do have an online group that meets that we facilitate. That is, we have just like I said, we're a very small community, so we have just 3 to 4 schools that we have in our area. So we try to open up to the school system so we can have, you know, cross school systems. So if like, hey, I bump into you from Marysville, I from Fairbanks, know who you are, and I'm able to speak with you, and because we all know each other from this group. So we facilitate that group where we're able to kind of to bring the kids together. And sometimes there's a lot of kids and sometimes there aren't. During COVID, there was a ton because they were looking for connection and we were trying to provide connection. So we facilitate that. And I know that my own child is very involved in a lot of online groups in her college to support younger people who are on their journey. And they kind of mentor in a way. And she's actually done it through a sorority. That's been really empowering for our kiddos to have that online community and know that, hey, these groups meet. And I list the ones even out of Columbus because that's our big hub, Columbus, Ohio. So that's our big hub. So I'll list all the Kaleidoscope ones too that like connect our kids with group meetings and things like that. So they're able, and I even have a parent group that we get together. So, you know, if there's parents that are new to this experience or new to navigating this system with their child, they're able to talk and have support and get information from parents who are farther down in the journey. So they don't want to make mistakes. They don't want to hurt their child. They want to do this correct. They say, do this correctly and you know, do this in a way that is affirming to their child. And so their child knows that they're truly supported and not out on an island by themselves. So that's kind of where we stand with it.
Thank you.
Alex, did you have anything?
I can't speak to this one, but I do want to uplift the importance of parents supporting parents. In particular, for me as a transgender provider, I lack credibility with many parents who are skeptical about their children's identity and journey. And I love referring parents to parents. Parents are going to have credibility like no one else does. And I'm not a parent also. Thank you.
Yeah, thank you for that. Thank you. Thank you, Nicole. All right, looks like Jamie, if you want to come off mute and ask your question.
Sure. Hi, Nicole and Alex. Pleased to meet you both. I just wanted to touch a piece on culture. You know, like I know you both have a lot of vast experiences with trying to, you know, facilitate and try to make a connection to what's best serve your child, the child that's in need, right? So, but thinking about the lens of mental health as well as culture, there's a lot of like barriers on top of barriers that you actually go through to be able to help a person more intentionally. So I come from a different background, a collectivistic view. And, you know, when in the US here, it's more individualistic. So the subculture is that you do not really have a way to verbalize some things that is actually like, what's a transgender person, you know, what it means to be someone who's different from ourselves. I mean, I'm not saying I'm the expert because I'm learning too myself. You know, when I grew up, I was told that this is something that is actually, oh, you know, there's a label for them, which is not kind. And I didn't understand it because I wasn't giving that kind of knowledge to know what intently that does to a person. I know that was just a joke, like in a way. But now when I'm in the States here, I becoming more and more aware that becomes very, very hurting. And I kind of like have to correct myself even as an adult. That's why I come to you in a sense of like, I'm concerned about, like not only our trans who is actually a person who actually have the verbiage of English, but people who don't have that way to, communicate because they have the linguistic challenge and they have the culture challenge, to be able to normalize a conversation in the subculture, then to the culture of the environment, the society that you are made in. It is very hard to kind of break through it. Are there any ways that you come about to do it in a way that would support? Or I know it's a very big question, but I'm just trying to find a way that we can actually all bring our, put our thinking heads together and see how can we do it better in a way that the intersectionality of a person is not really a miss, Am I making any sense? I'm sorry. So please enlighten me, share with me. Thank you.
Yeah, thank you. That's a very thoughtful question, and I really appreciate the like nuance of what you're bringing to this conversation. I think like I would want to look to leaders like LGBTQ people that are within your culture and language group. I imagine that they exist. There have always been trans people in many different cultures, or LGBTQ people, even if that's not the language, or there's other different culturally specific ways of understanding other genders or sexualities. Folks have existed, and there is leadership in likely in your culture or of folks that are well positioned to kind of attend to all of the pieces that you're talking about, the Western individualism versus the collectivism, and even like understandings like in my work, oftentimes like even mental health isn't something that translates well, never mind gender and sexuality, and the idea of accessing care is not culturally something that people would do. And so just like I think that folks within your own community and culture and are the right people to kind of lead those conversations, and then so seeking out those people, and depending on where you're located, that might look different in more urban areas. It might be more likely than it is in like different rural areas, but certainly like there are online resources. Yeah, but that's what I would be suggesting for you.
We have a very, very, very white rural population, so we struggle with culture even within our community. In all reality, the most culture that really comes into our community comes through adoption. And I have worked with several families that have adopted kiddos from China and Japan, and they have identified in the LGBTQIA community, and that took a lot of digging for me. I went to I went to Columbus because I knew we weren't going to have it here, so I went to Columbus and I dug and I tried to find cultural groups so I could understand the culture to better work with the families, because the kids did end up on my case. That was a good thing. I had that ability to have them on my caseload so I could learn what they needed within their culture and still celebrate their culture, but help their parents understand and help they come to grips with something that is very frowned upon from where they came from. And they made that abundantly clear to me. Like if I was back home, this would not be happening. So I was thankful that they felt the safe space to come out and be who they are. But it took a lot to find the resources needed to support. And I continue to work on that because it's an ever evolving, ever changing thing. And it is a challenge because we have so many new cultures to learn, you know, where they come from. My oldest daughter has been in Alaska, working on doing research for public health and public policy. And I mean, just what she's taught me from how they handle things in Alaska, you know, it's amazing how the different cultures work. So I'm continually always trying to find resources. If anybody has any great ones, I'll always take any pointers. So, because it is a challenge. It's definitely a very hard challenge, but I'm always there. My thing is I support parents wherever they land at. So if they come to me and it's a challenge for their culture, I will research that culture and I will find something if it kills me. It might take me a while, but I will find it. So that's really how I try to operate. So.
I want to say thank you for that kind of a support lens. And I'm a peer and committee, BIPOC peer and committee advocate. I'll be glad to connect with you all afterwards if you need that. We can bring more in-depth conversations because there's no one size that fits all. It takes a village to work with a village, right? So how can we help and support each other would be a way to go forward. And I'm sure that we can learn more from each other. And, I'll leave my contact. So maybe we can have another onward conversation if possible. Thank you. Thank you again.
Thank you. That was great. All right, looks like we have a question from Lindsay. Would you like to come off mute? No worries if not. All right, I'll go ahead and ask that question. So it looks like Lindsay lives in Texas. Where being trans, especially trans youth, is almost illegal. Yes, yes. How do we show up in a way that is supportive to those communities when they are in fear for their lives and their safety?
I want to answer this question with I'm approaching it with some hesitancy. I don't live in Texas. I've been to Texas one time and I had the most transphobic experience of my entire life. I will not go back. Sorry to paint Texas with like a whole brush in one experience. That's like not something I would normally do, but it was not good being queer or trans in Texas. Um, so yeah, I'm like approaching that, like, I don't know what it's like to live there. I don't know the policy context. I know that it's changing. And I want to also like speak from my own experience, which is a white person. I'm not a person of color. That we need to think about intersectional identities here when we're thinking about what our solidarity looks like. And as a white trans person that is like read as male, I have transitioned into some privilege where other people may not have that experience. So I just really, I'm speaking from my own context here. In my work as a white person and being in solidarity with communities who are under attack, marginalized in other ways, maybe from like police violence or other things like that, something that I have really tried to work on in myself is understanding like how people are unsafe and then locating within myself whether I'm really unsafe or not, or whether I'm uncomfortable. Okay. And understanding as a white person, for me to understand the difference between my discomfort and actual threats to my safety is really, really important because it means that I can like that in my case, like being in solidarity with people of color, with Black folks, right? Like Black folks will get stopped or arrested by the cops for doing things that I will not, right? And so when I'm like afraid showing up in my solidarity, am I really afraid? Like, what am I afraid of, right? And so really trying to unearth that. And so really understanding where my privilege is, and then what can I do? What can I get away with that it might not be possible for other folks to do? So, like sometimes like at a protest for me, that's meant like stepping off the curb or getting in someone's face or um saying things that make other people uncomfortable. Those are ways that I've used my privilege. Sometimes it's like being standing in front of someone, accompanying someone to a washroom so that they can use the washroom, and like standing in front of the door to prevent someone else from going in there. So, you know, things that I've done, like those are just some like really small examples. I think if I'd love for the question asker to elaborate if there's something more like specific that's happening. But like, yeah, I think that that's like, you know, and then like, I think also just like connecting to resources, like there are some like mutual aid efforts that are happening nationally to help trans people get access to care in other states. There's something called the Black Trans Travel Fund, which helps Black trans folks, in particular in the South, get access to care elsewhere. And then there's like states like California have enacted laws where they won't release medical records to other states. So, you know, it might be like something like that, like using your privilege in that kind of a way. But you know, yeah, I think, oh, I see that Lindsay's like come on camera, so I'll pause there.
Yeah, so it's more just like, so I'm a peer specialist, right? And as peers, we are trained that we are truth tellers, which means that I don't hide how I feel when I'm working with somebody, and I don't ever want to tell somebody that they shouldn't be the way they are. But like when they ask me, like, or when I'm talking to somebody who's trans and they're worried about their safety, I also don't feel like I should say you're safe, because they're not. Like in Texas, they're not safe. So like, how do you support somebody and help them in that way while kind of, you know, also, you know, letting them know that this is this might not be safe. Like, I mean, I have somebody who went to the Capitol and there were people with, you know, automatic weapons, like hundreds of people with automatic weapons in their face. I mean, so yes, I support you, but be careful. I like, how do you do that?
I think you're honest and you're
I,
real. Oh, sorry, Nicole, do you want to jump
no,
in?
I agree. I mean, you have to like tell them they have to think of their safety first. I we obviously in Ohio, it's not that complicated as it would be in Texas. I know Texas is really rough. But um just to find them someone, I work really hard here to cultivate people within our justice system in the town that we live in that are allies. And believe me, there are some. They may be hard to find and they may be challenging, but they do exist. And I have had a couple of sheriffs that are very affirming, and they will work with our kiddos when there's a crisis. I have a judge that's affirming. So just trying to find those people or educate the people in that system, like, hey, these people need to be protected. Like, they are human and they are worthy of protection, and you need to do your job without bias, which is one of the glorious what do you want to say, things they say when they become, because my husband is a first responder, do no harm. It's not just for doctors. So it is very important that to just find those allies and tell them at some places you may not be safe. And if you're not safe, you need to tell yourself, I need to get out of here. This is not a safe situation, and we'll revisit doing something about it later, but I need to leave. And so I think that's hard, because you don't want that to be the truth. You want them to have the freedoms to be where they want to be and do what they want to do. Unfortunately, that's the reality of this situation right now. And I keep hoping that we will do better as a nation. But unfortunately, there's a lot of places that just aren't there yet. And that's the hard part of it all.
Yeah, absolutely. And I think like understanding also like where people can have agency and feel like they have some. So like maybe that's like taking a self-defense class, having emergency contacts available, letting people know where you're going, sharing your location, maybe like taking a taxi, a lift home or something from like if you're at a Capitol protest and there's like people with guns showing, like, you know, just like planning for your safety. Like, I think there are groups of people that, like people of color and like women who have like always been planning for their safety, right? And so, like, trans people need to do that too. And that's just like part of that is like being pragmatic and like harm reduction. And don't stop living too, right? Like, find ways to keep living.
Can I ask one more question real quick? Do you know of any channels to, so I work a lot in harm reduction, speaking of, right? So when we give out, you know, we have needle exchanges, we give out supplies, safe use supplies, right? But one thing that isn't really talked about is giving, like, is there an organization or someone that helps provide free or low cost transitioning medicine or something, anything like that, right? To help, or even not medication, but supplies, right? You know, that we might be able to offer to people who are on, you know, who we're working with.
Like needle specific for hormone injection. Is that what you're?
I mean, not even just I mean, anything really that can be used, you know, for by people who are kind of transitioning and things like that. Like, but part of that, yes, would be like the
Clothing support.
yeah.
We work with Kaleidoscope. It's in Columbus. They have some resources. They are limited. We also have a program outside of our main state hospital. Our main state hospital is OSU, where my children go to college, Ohio State. Their state hospital has a whole program that provides support. So sometimes you may have to dig for those, but sometimes if you look at your state hospital, there might be an organization within there that helps with those things. I know if someone came to we're our county's FCFC, so our Family Family First Council. So that's what I work within. We provide stuff. If a family were to come into us and say, we have a child who's transitioning, they need undergarments or whatever, or binders or those kind of things, we go out and we help find them and provide them with our FCCS funds, and we are able to do that. So I've tried to find creative ways to create funding or create connections so those kind of things can be paid for and covered. And I mean, never underestimate those moms or dads who are like, I'm passionate, I'm gonna find me some rich person that wants to donate. I never count those people out. We have a guy here who owns our Honda dealership. It's humongous because Honda is based out of Marysville, and he donates tons of things to the cause, tons and tons and tons of money to the cause to help these kiddos. Because our suicide rate was so high in our county because of it. So sometimes it takes some boots on the ground, and I'm sure it's gonna be a lot harder in Texas, but God love you. That's a hard one. So
There are some like binder exchange programs and like different things like that that are available online. I'm not sure if they're national or not. But if you might want to try searching for that, there are some like nonprofits and like I know at least like Oregon and Washington, I'm sorry, and in California that have like mutual aid and offer those types of free and exchange services. There might be something national or something that's happening underground locally in Texas. It might help to get connected with local like LGBT centers. Often they offer like programs like that.
Yeah, I was trying to start a program like that because there just isn't anything where, you know. Thank you.
Thank you so much. I think we have time for one more question. I know we have more in the chat. So if our wonderful presenters want to share your contact information so they could, okay, thank you so much. So this one is from April. April, do you want to ask this question off mute? If not, I can ask. April Boulay, I think. Okay, no worries. All right, so Nicole, this one's for you. Could you elaborate on the art group that's been successful in your community? And then how have you been able to reach the community members to bring them in?
Okay, this was actually, we got so lucky with this. Where our building is located, we are right next to this incredible woman. Her name is Shauna Sue. I love her with all my heart. The most affirming and loving woman on this planet. And kids knew her already from just going to paint stuff, and like she does a paint night and a ceramic night and all those things. So the kids already knew about her and loved her, and she had a presence within the community. And there was another mom who had lost her daughter who was in the LGBTQIA plus community to suicide at 14. It was very tragic. And so the mom and Shauna Sue got together and they're like, what can we do? How can we reach these kids? And they're like, let's do an art night. And we put it in all the school announcements at the schools. They allowed us to be in the school announcements. We put out something from the Mental Health and Recovery Board. We put out something from our FCFC. And really, we had all our agencies kind of spam everyone that we could. And I had parents talking to other parents of people where they might have been more closeted, just say, hey, it's just an art group. You don't have to do anything, but this is kind of what it's geared toward if your kiddo may want to come. And we even had a couple churches support it. So it was great. And the kids love it. They absolutely love it. They get upset if it's shut down for the week, like if they can't make it. It's very popular. Shauna Sue donates everything. She's never asked for a penny, even though we would gladly give her some. She never lets us. And the kids, she brings her therapy dogs and they're great. And the kids love it. They love it. They don't ever want it to end. And I mean, they will fight like 6 inches of snow to get to it if it's happening. So we've just been really blessed. And we put it in every announcement at the beginning of every school year. So we're getting ready to have back to school fairs. So I go to those and I always broadcast it. And the mom who lost her child is very active in the community. So she's always open. Like I said, parents reaching other parents. There's really a lot of community in that. And then the parents, while their kids in art group, they can hang out and they can have that time to be like, am I doing this right? I don't quite know how to handle this, or what do you think? Or what are you doing with your kid that I may not be doing with my kid? And so it's been a really great experience, and it's just been a lot of legwork, but it's worked. And I think you've got to have a thing that people feel kind of comfortable at. They don't always necessarily do an art project. Sometimes they just sit around and talk. So, I mean, and they go on little adventures together, and it's just been a really great experience, and it grows every time. So we love it. So.
Awesome. Thank you so much. I know we have just a few minutes left. It doesn't look like we have any more questions. So I think if we're good to go, we can probably stop here. I see lots of different resources in the chat, as well as thank you to our wonderful presenters. There's some contact information being shared, so maybe we can hang out for just a minute or so to get that contact info. And Nicole, if you would share your email, that would be great. I see Alex shared. Yeah, thank you again, everyone, for participating today in this conversation and for being here. We look forward to seeing you next month in the next PACT session.
Thank you,
Thank you
Eve.
for having
See you
us.
again. Bye.
Thank
Thank
you.
you, Nicole. And
I put my phone number. I am not opposed to phone calls or texts, so please feel free if you want to connect.
Nice.
I will get back with you.
Quick question, Bridget. Do we offer CEUs for PACT? Can't remember.
Yes, we do. The survey to request a CE hour will be after the survey for this session. So you'll get that as soon as we close out, and it'll be in the follow-up email along with the presenter's contact information.
Oh, perfect. Thank you.
if that shall be all.
Yes. Thank you all so much. We appreciate you and hope you have a great rest of your day.
Thank you, Eve. Bye.